Hi everyone, Dr. Campbell here with our last video in our CCA exam review. This is part 7, where we're going to focus on domain number 6. All right, so as it relates to domain number 6, the tasks that you are to perform have a huge focus on HIPAA, privacy, and security regulations. If you have not done so, I highly recommend that you go to the federal government's website and download the summary of the HIPAA privacy law and the security law and just read through it and just really embrace what those two laws have to do with coding and access to health records and release of health records and protecting health records. That's what this particular domain has a huge focus on. So first up, we're going to look at patient confidentiality. As you may or may not know, there are certain pieces of data that pertains to a patient that we really want to protect. And those data are elements that can be used to easily identify a patient. So it can be a phone number, it can be an email address. I know that I have seen situations, and we've seen this in the news recently, where individuals are being told that their email address is on the dark web, and they recommend that you change your email address. So when we're accessing a patient's medical record, we want to maintain that patient's confidentiality. And I always say we should treat the patient's information like we want our information to be treated. Additional areas of data related to the patient, their relatives, as well as a picture of the patient, is personally identifiable information. Next area has to do with educating staff. Now, remember earlier I mentioned going to the government's website and downloading the privacy and security laws. On that same website, guys, you can actually locate training materials created by the government. This particular training helps us implement privacy and security protections. So some organizations may have their providers or staff go to this website and do this training, or we could use this information to create training for our organization. And there's lots of information here. If you notice, there's information on covered entities and business associates, very important. All right, next up, you want to be able to recognize and report any type of privacy security issues, such as a breach. A breach generally is a situation where the patient did not give permission for us to use or disclose their information under the privacy rule, and it essentially compromises the security and privacy of PHI, or protected health information. Now, if you notice a theme, we're talking about privacy and security. An impermissible use or disclosure of PHI is presumed to be a breach unless the covered entity or the business associate, two terms you should be familiar with, again, covered entity or business associate, demonstrates that there is low probability that the PHI has been compromised based on what is known as a risk adjustment. And you can actually Google that as well. But some of the factors related to the risk assessment are really about the nature and extent of the PHI involved. The unauthorized person used the PHI, whether the PHI was actually acquired or was it viewed, and the extent to which the PHI has been mitigated. Next up, we want to look at the secure work environment. And as it relates to secure work environment, there are 3 safeguards that you will want to be familiar with. Administrative safeguards, I think of those as our policies, right? Because those are documented formal practices that we have in place to manage security measures throughout our organization. But then we also have physical safeguards. So physical safeguards have to do with protecting the facility. So having safeguards in place to control access to areas where PHI is perhaps located. That also deals with workstation security. So when you are logged onto your computer, you are looking at PHI. If you need to walk away to go to the bathroom, you're going to do Control-Alt-Delete to lock your screen so that no one can actually see it. Now, contrary to popular belief, just turning the monitor off is not enough. We want to make sure that we can do Control-Alt-Delete and the individual cannot access the information. Other physical safeguards could be device and media controls where we have additional protections on those particular devices. And then lastly, but not least, technical safeguards. Here is where we have certain provisions in place, such as controls. So access control. Individuals have access to the system based on their role that they are performing. So for example, someone who works in dietary is not going to need access to the entire patient record. Technical safeguards also have to do with the audit controls that we have in place. Running reports and identifying if individuals are accessing records that they should not be accessing. Next up, passcodes. So as it relates to passcodes, and this is something that we all are aware of, it's important that the format be a particular length. It's a combination of letters and numbers that make no sense. Doesn't include any personal identification. It includes uppercase and lowercase numbers and numbers and symbols so that it cannot be easily identified. And then of course, we want to protect our passwords and not share them with anyone. Additionally, our passwords should be updated quite frequently. Most facilities have a 90-day rule where the password has to be changed. Next up is the concept of minimal necessary or minimally necessary. So the HIPAA rule actually requires that when a covered entity or a business associate, there's those words again, covered entity, guys, a provider, a plan, or clearinghouse. So whenever one of those two individuals of a covered entity uses or discloses PHI, or when it requests PHI from another facility or a business associate, the covered entity or the business associate, also known as BA, must make reasonable, notice the word reasonable, efforts to limit protected health information to the minimum necessary that's needed to accomplish the intended purpose. And so that's either a use or disclosure or request. So I always remember minimally necessary by the abbreviation TPO. Minimal necessary, what's needed for treatment, to carry out treatment, for payment purposes, as well as operation of the healthcare organization. Next up, release of patient-specific data. We have internal requesters and external requesters. So internal requesters could be providers, patient care management support staff, as well as those involved with reimbursement. Then external requesters could be the government, it can be an employer, it can be an attorney, it can be for research, it can be for audits. It can also be requested by the insurance company. All right, next up, we're going to look at encryption. So encryption is a method of encoding data that then kind of converts it to a jumble of unreadable, scrambled characters and symbols as it's transmitted through a telecommunication network. And the goal of this encryption is so that the data is not understood by persons who don't have the key to transform that data into the original form. And so data are usually encrypted using some type of algorithm. Now, once the individual that is intended to receive the information, the data can only be decoded and restored back to the original readable form, which is decryption, by using a special algorithm. Encryption essentially takes the message from one computer and encodes it into a form that only the receiving computer can actually decode. All right, next up, guys, secure sites. And secure sites can be a variety of things. There is a concept called cryptography. We can protect information securely via passwords. There are programs such as SharePoint that can be used as a secure site to protect our patients' information. And lastly, guys, we're going to look at record retention and record destruction. Now, AHIMA actually has some great guidance on record retention and destruction. According to AHIMA, at a minimum, our retention schedule, and this is our policy, it must ensure that the information is available to meet the continued needs of the patient care, legal, research, education, and other legitimate reasons that the organization needs to use the data, minimal necessary. It should also include guidelines that specify what information is kept and how it's going to be kept. So is it going to be a paper record? Is it going to be microfilm? Is it going to be scanned in? And then our record retention policies must include, at a minimum, clear destruction policies and procedures that identify how each method is going to be destroyed. So how paper will be destroyed. You know, is it going to be shredded, for example? And then lastly, as it relates to record destruction, some destruction methods are burning of paper or shredding, microfilm. It could be recycled or pulverized. Laser discs can be destroyed by pulverizing. Computerized data can be destroyed by a magnetic degaussing procedure. DVDs can be shredded or cut, and magnetic tapes can be destroyed by demagnetizing them. All right, guys, thank you so much for listening to the series on the CCA exam. Be sure to check out some of my other playlists, which include ICD-10 CM, ICD-10 PCS, and CPT coding. Have a great day.